Brandon's an active man and father from Nebraska.
I'm 28 years old. I'm a paramedic, and I do that part-time, and I have a full-time construction company. We do some residential remodels and some light commercial work. I really enjoy jiu-jitsu. It has really helped with my back injury, keeping everything mobile. I've had some back issues in the past. As a paramedic, I would take a lot of transfers, a lot of trips on the roads. The seats aren't really built for good posture.
As a paramedic, Brandon injured his back while performing an emergency extraction of a person at the scene of a serious car wreck.
I just physically removed the patient from the car to get them where I could treat them. At that point, I definitely felt I did something to my back. The back pain impacted my life in every way. I was off work for about 8 months. So I had to sleep with a pillow under my legs. At some points that I couldn't sleep. I probably functioned on like a 20 or 30% level compared to what I normally do. So I wasn't able to do most daily tasks. I wouldn't pick up my children. I wouldn't be able to bend over and tie my shoes very well. Everything took a lot of time getting out of bed, getting dressed for the last 2 years has been very difficult.
Brandon tried numerous conservative treatments, but nothing helped. After seeing a surgeon in his hometown, he decided to fight through the pain rather than undergo surgery.
They did MRIs, X-rays to make sure I didn't damage anything structurally. So I have degenerative discs and then bulge discs and an extruded disc. And basically they sent me to physical therapy. I did chiropractic care. They put me on a bunch of pain meds, which, that don't really help. Basically the neurologist just said we should just do surgery and fuse 3 levels and you'll be good to go. You won't have any more issues. But with 30 plus years left to work, I didn't feel that was a good option. Workman's Comp basically said, get fused or go on permanent disability or be healed. And I said, well, I'll just try to live with it. Being as young as I am, the idea of fusion was not something I wanted to follow through with, just because I knew that as soon as you have a fusion, you're going to have to start adding fusions on either level just because of the damage that's going to cause to each one. I thought I could just work at a very low level and it would start to get better, is what I thought. And so I gave it, about 2 years, and then it just started slowly going downhill, getting worse and worse and worse. And then I decided I needed to do something. I didn't want to do a fusion. And so my wife started looking on the internet, and then I started watching YouTube videos, doing some research, and then decided that this was a very good option, especially being it's so minimally invasive. And the quick recovery time. As soon as my wife found Bonati Spine Institute, she sent me a link, and I opened it up, super easy, filled out the little questionnaire, and they said, hey, we'll call you within like 2 days. I had a call within like 15 minutes. The process was super easy. They asked a couple questions. Everybody was really nice. And they said, hey, we'll have somebody call up with a follow-up call within the next 2 days. I had that within the next 30 minutes. And so literally we found Bonati online one day, and the next day we had the ball rolling and started everything. The process was started.
After sending in his MRI for review, Dr. Bonati called him personally to say he was a good candidate for the exclusive Bonati Spine procedures.
I never met Dr. Bonati before. He reviewed my MRIs that I had originally, and was able to tell me where my pain was from that. So the feedback I was getting from Dr. Bonati was this is the issue. It was a very big sense of relief to be able to talk to Dr. Bonati, to be able to see that he had a plan, to be able to see that, my 28 years that before, that wasn't all that I was going to be able to function in life. It was a very big relief to be able to realize that, hey, maybe there's a path that I can go forward and I can actually live and do things.
Upon arriving at the Bonati Spine Institute, Brandon received a physical examination and updated his MRIs at the on-campus imaging center. Just minutes later, Dr. Bonati reviewed his new imagery with him and outlined a customized surgical plan to eliminate his pain.
You walk in the front door, you have a receptionist, he points you right to the clinic, they do everything right in the clinic. Right out the clinic, you have your MRI and your X-ray machines, and they're just very close. So it's really nice. Go over there, the staff is very friendly. The MRI machine is a lot smaller than the other ones that I've been in. It was a lot better of an experience than the last MRIs that I've been in. And then you come back in, and they've already reviewed your MRIs. They go through your MRIs with you. The doctor comes in, and they pull it up on a large screen. They show everything. They pinpoint exactly what's going on and show you where, and then talk you through the plan, the treatment plan. Everybody takes their time to make sure you understand what's actually going on.
The targeted Bonati spine procedures are performed incrementally using conscious IV sedation, where the surgical guest remains awake and communicating with their surgeon to ensure their pain is eliminated before they leave the operating table.
They moved a TV screen over so I could watch, which was really, really cool. And they kind of talked me through the process, and it was, I really appreciated it. It was really neat. They would ask me, does this hurt? Can you move this? Can you move this leg? Does this hurt if you move this leg? They asked me to do like a modified push-up, which I haven't been able to do for like 2 years without pain. And I did it, and there was no pain, and that was really exciting.
Back pain should be totally gone.
Okay, so just like a straight push-up or for...
Yeah, push up. All the way up, higher. Then
Now arch your back like that.
Arch
Yeah,
your
there you
back,
go.
so a half push-up.
no back pain?
Oh,
No?
no back pain at all.
All right, good. Down.
And I did it, and there was no pain, and that was really exciting. I think the surgery is amazing, and being awake for part of it, the idea is really amazing. I don't think anybody should be scared to go through that process. You feel a little discomfort, but you don't really care. It's not that bad. It's not significant. It's not like the pain you deal with every day. You'll feel movement, but overall it's a really neat process.
Brandon, like many surgical guests of the Bonati Spine Institute, was surprised at just how quickly he was able to be up and walking in the recovery room pain-free.
I noticed I could feel my left foot again, and it felt like I had a new foot because I hadn't really felt my foot for 2 years. In the post-op, they brought me in, they put a nice warmer in the blanket, everything was really nice, and a couple of minutes afterwards, they helped you up, and they said, hey, let's go for a walk, and I didn't really think I was going to be able to do it, but I got up and I walked, and it was really good. If you're in your 20s and you have back pain, this is a very good option. Please try it before you lose hope. I would definitely recommend the Bonati Spine Institute to anybody who, before you go put hardware in your back, try this, because it is way better. The whole process is streamlined. The amount of work that it takes to actually get this set up there's not much there. It's amazing how quickly the process can go, and really the quickness of how you heal. I'm very surprised at how fast I've healed and been able to get back to kind of just normal daily life after a spinal surgery. At the Bonati Spine Institute, when I'm done with the surgery, I can walk out and there's no brace, there's no special physical therapy other than walking around and your normal daily life light. I look forward to getting back to work and being able to hang drywall and move trusses and being able to roll in jiu-jitsu and get back on the mats. I'm really looking forward to that, being able to pick up my children without my foot going numb and my back hurting a lot.